My friends, listen to me. We need to have a serious, unfiltered conversation about a topic that so many of you are suffering with in silence. I am talking about your mental health. I am talking about the anxiety that keeps you up late at night, staring at the ceiling, wondering if your money is going to last as long as you do. I am talking about the profound, heavy grief of losing a spouse, or the isolation that creeps in when you stop working and the house gets a little too quiet. Too many of you are sitting out there right now believing that your mental well-being is a luxury you cannot afford. You think, Susie, I'm on a fixed income now. I can't pay hundreds of dollars an hour out of pocket to talk to someone. I just have to deal with this alone. No, you do not. I want you to take a deep breath right now, because I have some incredibly good news for you. Medicare does cover mental health services. And right here in 2026, there are major, permanent changes that make it easier and more affordable for you to get the help you deserve than ever before. And you knew there was a but coming with Susie, didn't you? If you do not understand the specific rules of the game, you are going to get hit with bills that will absolutely devastate your monthly budget. I am not going to let that happen to you. Let's stand in our truth and look at exactly how this works under Medicare Part B, which is your medical insurance. For years, one of the biggest roadblocks for seniors seeking therapy was simply finding a doctor who accepted Medicare. You would call office after office, only to be turned away. That fear of rejection, that feeling of helplessness, ends now. Because Congress stepped up and made a permanent change that is fully active. Medicare now officially allows licensed professional counselors and marriage and family therapists to enroll as Medicare providers. This means thousands of new, qualified therapists are now in the system. The network has opened up, which means help is closer to you than it has ever been. But what is it going to cost you? You know I care about your pockets. For outpatient mental health services, whether that is individual therapy, group psychotherapy, or a psychiatric evaluation, Medicare Part B covers 80% of the Medicare-approved amount. That means your responsibility is the remaining 20% coinsurance. But wait, you have to satisfy your annual Part B deductible first. And for 2026, that standard deductible has gone up to $283. You must pay that first $283 out of your own pocket before Medicare pays a single dime. After that, the 20% kick-ins. Now, if you have a Medigap supplemental policy, or if you are enrolled in a Medicare Advantage plan, that 20% might be completely covered or reduced to a small, predictable copayment. In fact, for 2026, Medicare Advantage plans are strictly required by law to match or improve upon traditional Medicare's cost-sharing for behavioral health. They cannot charge you more for mental health than you would pay under original Medicare. So check your plan. Now, let's talk about a major victory for your convenience and your emotional safety, telehealth. Let's face it, when you are suffering from severe depression or physical limitations, just getting dressed, getting into a car, and driving to a clinic can feel like climbing Mount Everest. You ask, can I just talk to someone from the comfort of my own living room? Yes, you can. Thanks to new legislation signed into law, Medicare has made the ability to receive mental health telehealth services from your own home permanent. There are no geographic restrictions anymore. It doesn't matter if you live in a crowded city or a tiny rural town, you qualify. And listen to this, because it is vital for those of you who struggle with technology, Medicare permanently covers audio-only, phone-only sessions for mental health. If you don't have a smartphone, or if your internet connection is weak, or if you simply do not want to be on camera, you can use your regular landline or mobile phone. The only catch is that your provider must have the capability to do video, and you must choose or require the audio-only option. But I need you to listen to me very closely right now, because here is the trap where you could get financially burned. While the home location and phone options are permanent, Congress only temporarily delayed the strict in-person visit requirement through December 31, 2027. What does that mean for you today, in 2026? It means right now, you do not need to see a therapist in person before starting virtual therapy. You can start completely online or over the phone. But you need to know that this waiver is temporary, so enjoy this flexibility now. get established with a doctor today, and don't let the fear of a complicated process stop you from initiating care. What about your prescriptions? If a psychiatrist prescribes you an antidepressant or an anti-anxiety medication that is handled under Medicare Part D, your prescription drug plan, you must check your specific plan's formulary to see what tier your medication falls under. Do not just assume it's covered. And if things ever get so severe that you require inpatient care in a psychiatric hospital, Medicare Part A handles that, but you must be aware of the lifetime limit. Medicare will only pay for a total of 190 days of inpatient psychiatric hospital care in your entire lifetime. Once you hit that 190-day wall, Part A stops paying for specialized psychiatric hospitals. It is a strict limit, and you must track it. First, remember that you do not need a referral from your primary care doctor to seek mental health services. Medicare allows you to self-refer. You have the power. Second, before you book an appointment, you must ask the provider one golden question: do you accept Medicare assignment? If they do not accept assignment, they can charge you way above the Medicare-approved amount, and you will be left holding the bag for the excess charges. Only see providers who accept assignment. Third, utilize your free benefits. Medicare covers one depression screening per year at absolutely zero cost to you, provided your doctor accepts assignment. Do it during your annual wellness visit. My friends, your peace of mind is the ultimate form of wealth. Do not let shame, do not let confusion, and do not let the fear of costs keep you from the joy and serenity you earned for your retirement. The coverage is there, the laws are on your side, now take control of your life and use them.